much for joining me today.
Absolutely.
We're talking about men's health, and just before we get started, I just want to put the disclaimer out again that this is a live video specifically for informational purposes and not intended to diagnose or treat any kind of condition. Please seek your medical professional for that. We're here to just chat, and we're all here about learning more about men's health, testosterone, and hopefully more. So let's get started. Any questions, please do send us a little chat. Hello, everyone. I see people are joining us, and I just want to give it a few more minutes for people to join us. Dr. Newell, do you want to tell us about yourself for a little bit?
Yeah, absolutely. I'm a naturopathic doctor here at Holistique Naturopathic Medical Center. Focus on men's health, do physical and sports medicine, and some IV therapy as well. So first IG live, so just breaking it in.
That's awesome. I know you're a little bit nervous about this, but it's awesome. I'm so glad that you are joining me to discuss this, since you are the one at Holistique that does a lot of men's healthcare over here. So tell us a little bit about lifestyle changes and things that we should do as men, not we, I guess, as men should do.
Yeah, also, there's a lot of things we can do to help, especially with testosterone levels for men. There's a lot of different hormones we could get into, but just focusing mainly on testosterone. Number one, getting enough sleep. I can't emphasize that enough. I try to get my patients to at least get 7 to 8 hours of sleep a night. If we get 8 or 9, I love that even more. But in today's world, it's pretty tough to kind of fit all that in with the day-to-day activities and work and children and families and stuff like that. So I get that. A lot of cool studies just focusing on sleep and testosterone levels. Actually, out of the University of Chicago, there was a study that showed that testosterone levels actually drop in men that don't get enough sleep. And it was interesting in this study that they actually found that just after a week of restricted sleep, daytime testosterone levels actually drop by up to 14 to 15%, which is pretty substantial. And also after men hit the age 30, we usually see about a 1 to 2% per year drop in testosterone levels as well. So there's many different things just in the sleep realm. Getting 7 to 8 plus hours a night can help boost testosterone levels.
That's crazy. Something simple just like that, right?
Yes.
That's men to sleep. And, you know, I know from my husband and other friends that are men that oftentimes they're hanging out in front of their TV or computer till late. And then they're wondering why they're tired and not having the oomph that they used to have as a 20-year-old. And so the sleep does make a difference. That melatonin level going up when you allow your body to sleep, the growth hormones going up when you allow your body to sleep, and also getting off of the computer system, because the electronics, the screens, the cell phones, the television, all of that suppresses the melatonin production, and it doesn't allow the growth hormone to increase and the testosterone levels to increase. And so the sleep that you may be getting is not going to be as restful and as restorative as we like it to be. So that's great. Simple things, 7 to 8. I prefer 8 to 9 for men and 7 to 8 for women. But it's a great thing to try to really get to bed. What else?
Just some other things too. Staying active and losing weight. We're trying to focus on whole foods diets, dark and leafy greens, some lean proteins, fish, chicken, some meats. Weightlifting is a great way to boost testosterone levels. It increases muscle mass, and the body starts to produce more testosterone because of that. And also, you're strengthening the entire body too, and it helps prevent injury, speeds up your metabolism, also helps to boost the immune system. So many different factors that not just focus on testosterone, but the whole body as a whole. And also, there's some other types of weightlifting, some other forms of training as well. High intensity interval training, also great. There's a lot of studies out there that have shown that this type of training actually increases testosterone. I like to do this in combination with weightlifting. high intensity interval training with weightlifting. There's some good studies out there show that this combination also will enhance testosterone and also produces and enhances heart health too and cardiovascular health.
Exactly. Thank you for sharing that. So one of the things that I find a lot of men and women do is that they're burning through their testosterone because they're burning through their adrenal glands and increasing their stress by doing these prolonged aerobic exercises, like an hour workout, 7 days a week, and not really giving their body a break. And that is counterproductive. Don't you think that the elevated cortisol levels actually break down the testosterone and also break down muscle tissue? So if you're working out to build muscle, and here you are spending an hour doing intense aerobic and then weights, it's kind of counterproductive to building muscle and building testosterone. Don't you think it's better to focus in on more shorter amounts of aerobics, like the HIIT spurts of it, and then doing 3-4 times a week of strength exercising and resistance work?
Yeah, absolutely. Absolutely. I think when you start doing these long endurance types of training, you just got to be careful because, like, as you said, our cortisol levels tend to spike when this happens. And cortisol, just for everybody out there, is just a hormone in the body that is released in response to stress or some kind of threat response. And when we have that elevated for a chronically period of time, whether it's weeks, months, years, in most cases, it actually leads to reduced testosterone levels, loss of libido. We also see erectile dysfunction because it has the opposite effect of testosterone. It's catabolic, so it's breaking things down. So when that's elevated for extended periods of time, you're going to see our hormones, not just testosterone, but all of our hormones take a hit.
So I want to go back a little bit and talk a little bit about what testosterone does in our body, especially for men, but this also applies for many women out there, that testosterone is involved with libido, your sex drive. That's the first thing most men and women think about. But there's a lot of other benefits to having testosterone. For instance, mental well-being. When there is a brain fog happening in men, a lot of times it can be because of low testosterone, right? And then obviously the muscle mass and strength is all related to testosterone as well. But this concept of decision making, so the ability to be really strong and forthright with your decisions is partially a testosterone thing. And when you're having trouble making decisions, whether you are a man or a woman, that oftentimes the testosterone levels are low and they need to be addressed. But here's the other thing is that, I also see a lot of men get checked for testosterone. Oh yeah, your testosterone is low. By the way, less than 300 on your blood work is a low testosterone level, right? I like to see it over 550 on the blood work for men. But in any case, so you see this low testosterone, and then the men are put on some injectable testosterone or given, sometimes I've even seen oral testosterone, which is absolute no-no. So if you're a guy out there and you're on oral testosterone, please revisit this with your doctor or seek another provider, because oral testosterone is very, very toxic to the liver, and it can increase risk of other conditions like cancer. So please make sure you're not on oral testosterone of any form, and instead are using something either topical or injectable, or what we also do here is pellets, which are little grain, size of a grain of rice that is implanted under the skin. And we can do this with other hormones as well, like DHEA and pregnenolone and progesterone. And we just insert it under the skin, and it stays there for few months, but anywhere between 3 to 6 months, depending on how fast you're burning through your testosterone by the stress factors that are involved in your life. So So I don't want to see elevated testosterones. I don't want to see too high of a testosterone. I don't want to see too low of a testosterone, because either way can increase the risk for especially prostate cancer in men, right? So one of the things I tell my male patients quite a bit is that imagine the 15, 20-year-olds, they're raging in high testosterone levels. And yet the risk for cancers is very low. And so testosterone supplementation is not dangerous unless it's the wrong form. For instance, it's a synthetic form, or it is too high where you're getting numbers of 1,200 or 1,500 on your blood work is way, way too high. So too high or too low can increase your risk. But if we keep it balanced, and that's the key, right? Keeping hormones balanced is going to help with keeping the risk factors low and optimizing our function, both brain-wise, muscle-wise, energy-wise, sleep-wise, and all sorts of good stuff there. What else do you have to share with us, Doc?
Yeah, so just going over some symptoms of low testosterone. We're going to see reduced body and facial hair. We're going to start seeing loss of muscle mass. Our libido takes a hit. You can have some erectile dysfunction. We're going to have reduced sperm counts. You start to see increased breast size in men. Like you were mentioning before, poor concentration. There's even been some studies that show that depression and anxiety start to show up with low testosterone levels. Increased risk of fracture. So what's going on? Why is this happening? Well, our testes are producing less testosterone, number one. And why is that? Because we start seeing fewer signals from the pituitary telling the testes to make testosterone. Also, as we age, we see an increase in a hormone or protein called sex hormone binding globulin. And this binds free testosterone. And we start to see less free testosterone in the blood because of an increase in this protein. And when we have high levels of sex hormone binding globulin, we start to see low libido levels, erectile dysfunction, and infertility start to pop up. So just things to be aware of. Testosterone is synthesized in the body from cholesterol, but because we have high cholesterol or we eating diets high in cholesterol doesn't necessarily mean we're going to have high testosterone. So something to be aware of.
And that's one of my issues with Western medicine is that if men are having high cholesterol or high blood pressure, especially high cholesterol, immediately they are put on statin drugs to bring down that cholesterol. Well, then we don't have the building blocks to make the hormones that are so necessary to keep the cholesterol low and to keep the blood pressure low. So it's like this catch-22 where you're depleting those hormones because you are further depleting the hormones because you are reducing the cortisol, the building block for the testosterone, by giving anti-cholesterol medication. So it's actually better if we do it the other way around, which is putting men on a proper diet, and we'll talk about diet in just a second, but putting them on a good diet, and then also helping their testosterone levels increase, not only by maybe addressing the testosterone, but by also addressing the cortisol level and the stress level that they're under, and promoting their body to make testosterone. So I'm always a fan of getting the body to make these hormones first before we start giving extra testosterone, because when we do give extra testosterone, it does suppress the body's own production of it, and then you're dependent on that testosterone for a lifetime. Whereas if we can get your body to build that testosterone, then we're helping your body heal from the inside out instead of from the externally and suppressing conditions, right?
Absolutely, and I think that's important what you mentioned about the statins too. Even when people are put on statins, we start to see our CoQ10 levels get depleted. So something to look out for supplementation-wise as well. Definitely.
And CoQ10 is so vital for the mitochondria, that cell engine function and muscle building as well. So if we're already being depleted by the statin drugs, we're going to be having not only reduced testosterone, but actually reducing the function of our heart muscle and other muscles throughout our body.
Absolutely.
So what else do you have to share with us, Doc?
Yeah, you mentioned a little bit about the diagnosis. I want to talk about that a little bit. According to the American Urological Association, Dr. Darvish already mentioned this, but testosterone levels under 300 nanograms per deciliter. I also like to see that number in the 550, 600 range, where men can start feeling a lot better. We also, in order to make this diagnosis of low testosterone, two measurements of total testosterone are taken. That's typically done in the morning because that's when testosterone levels are the highest in men. And when we take those, we also got to make sure the patient is not sick because that can create false results in the testosterone levels. When we have low blood levels of testosterone, we want to see that with signs and symptoms of low testosterone. As I talked about before, we start seeing increased breast size in men, loss of libido, erectile dysfunction, all these different signs and clues that clue us into low testosterone levels. There might be some adjunctive testing that we do. Something we do at Holistique Naturopathic Medical Center is something called the Dutch test. I don't know, Dr. Darvish, if you want to hop into that a little bit more.
Sure, I love the Dutch test. The Dutch test is relatively a new test. It's been out probably less than 10 years. And it has kind of replaced the salivary cortisol and hormone panel test, which we used to use 20 years ago, 25 years ago. I used to use that test quite a bit. And it showed us the levels of not only your testosterone, but of cortisol and DHEA and progesterone throughout part of the day. And so now it's being replaced by the Dutch test, which stands for dried urine comprehensive hormone test. And it is a urine test again, but it's a dried hormone sampling, which means that basically you urinate on a filter paper, and you do this 4 times, typically before bed or before dinner, before bed, in the morning, and 2 hours after you wake up. And then you let the papers dry and send them to the lab in Portland, and they evaluate a whole load of hormones. So they evaluate all the steroid hormones, which means your testosterone, your DHEA, your progesterone, your estrogen, but also your cortisol level and all the byproducts and the way your body's breaking down these testosterone and the estrogens, which is so important for keeping the hormones balanced. So it's not just about looking at the absolute numbers of the hormones. It's also about the way we break them up and eliminate them. And oftentimes those byproducts are more toxic to our cells and can cause more cancer and inflammatory disease than the actual hormone by itself. Plus, the Dutch tells us if you're vitamin B12 deficient, vitamin B6 deficient, something called glutathione, which is what I call the super duper antioxidant involved in the natural detoxification of our system and many other parts or systems in our body. And it also gives us a hint as to the genetic SNPs that may be going on that may be delaying some of the detoxification system of some of these hormones in our body. It further gives us neurotransmitters like your dopamine levels and your serotonin levels and the norepinephrine levels. So your anti-anxiety, antidepressant levels as well. And there's a question, can men and women do Dutch tests? Yes, I do this for both men and women and get a full evaluation of all these hormones. Now, the reason we also do this test is to look at the balance between estrogen and testosterone, especially in men, because testosterone, if supplemented, sometimes can become, through what's called the aromatase enzyme, can become estrogen. And when the men's levels of estrogen elevate, especially estradiol, then it's kind of suppressing the testosterone and the way the testosterone works in the body. And so your body thinks that you're low testosterone, though you're actually high in estrogen. And we need to bring the estrogen levels down. So it's very, very important to look at the estrogen levels. When men get older, we see the estrogen naturally rise. And that's when they get the male boobs and they get a little bit of central obesity around the abdomen, and they gain their weight. And it's because too much estrogen. And you know what the sad thing is that I'm seeing this in younger and younger men. I'm seeing this in teenagers, in 15, 16, 18, 20, 25-year-olds, when they should be high in their testosterone, low in estrogen. We're seeing the opposite. And this is because part of it is because I believe the electromagnetic fields and the sedentary lifestyle that a lot of boys are leading nowadays, sitting in front of the computers, doing their homework, but also maybe playing games, video games, and spending a lot of time on screen. And that is reducing the testosterone levels, but it's also causing a lot of depression. It's causing a lot of anxiety. And then you're seeing this drop of testosterone also carry forward in the 30-year-olds and 35 and the 40-year-olds. And then by the time they're 50, I'm going to be afraid to look at these men at 50 because they're not going to have much testosterone unless we start doing something about it at a very, very young age and shift the lifestyle and correct some of the stress that they're under physically, mentally, and emotionally, help them with the depression and anxiety and balancing some of these hormones.
Yeah, I think that's important that you mentioned in there, including the weight loss. Maintaining a healthy weight is super important. We see a lot of obesity, especially with the standard American diet, and how that wreaks havoc, just not on testosterone levels, but our endocrine system as a whole. There was a study that was recently done, and it showed that patients who lost about 5 to 10% of their total body weight showed reductions in triglycerides, total cholesterol, LDL levels, and those HDL levels started to rise. And not only is that great for your overall health, but it's lowering our risk for heart disease, it's lowering our risk for various types of cancer, and also helping to bring those testosterone levels in our endocrine system back up. And it doesn't take much to get to get moving. So there was a recent study that was done, 15 minutes, 3 times a day. Get up, move around, increases testosterone levels. So it's great.
So there's a question, thank you, Dr. Newell, for that. There's a question about diet and how keto diet and paleo diet affects testosterone. Do you have any comments on that?
Yeah, I mean, I'm not a huge fan of these fad diets out there. I'm more of a whole foods, incorporating dark leafy greens, reducing alcohol levels, which I'll get into a little later. And just focusing on lean proteins like salmon or some kind of fish that isn't high in mercury levels or other heavy metals. Some chicken and grass-fed beef, antibiotic-free, pasture-raised. That's the diets I try to focus on and tell my patients to focus on it as well.
So just for me to mention, make some comments on that as well, is that when you are on a keto diet or a paleo diet where you are having very low carbohydrates in your diet, then what you're doing, which is part of the reason most people are doing that, is because they want to burn through their glycogen stores, the carbohydrate stores, in order to force the body to use fat as a source of energy in the system versus carbohydrates. And that's okay to do that for a short period of time. But when it goes for too long, when it goes for more than 4 or 6 weeks, then you are causing an insulin response and the cortisol response in the body. So you're actually causing an insulin resistance issue in the system, which further will reduce the testosterone long term, right? So it's actually counterproductive again when you're doing these diets for too long. So I am a fan of more of a whole foods diet, but also more of a plant-based diet. So eating less meat and doing more plant-based. In fact, there is some studies coming out looking at the plant-based proteins and a plant-based diet compared to a meat protein, and how a plant-based diet actually does increase the testosterone levels more than a meat diet does. And this is one of those meat industry phenomena that we've been brainwashed with is that men need their meat, right?
And their dairy.
And their dairy, yes. And so, and that's not the actual truth when it comes to the biochemistry of the body and how the cells utilize nutrition, not only short term, but long term. So I do think that more of a plant-based diet, and if you are addicted to your meat, then do have, like Dr. Newell was saying, some wild caught fish like salmon, the low mercury fish like salmon and cod and trout and sardines, and try to leave the halibut and the tuna out because those are much higher in the mercury level. And as we know, mercury is one of those metals, and lead as well, that tends to sit in the glands, like your thyroid gland, like your adrenal gland, and like your testes or ovaries. And so what that does over a long period of time of building up metal in these glands is it will cause a dysfunction in the way the body is releasing these hormones and the amount of hormones and the quality of hormones that are being released. So it is very, very important to address the toxicity, especially of metals in our system. The glands, let's talk about the thyroid for a second. The thyroid, again, sits here. It's one of my favorite glands to discuss because it is often misdiagnosed and missed, period. So it doesn't show up on laboratory testing majority of the time unless it's very, very severe. So if you have a dysfunction versus a disease of the thyroid, it may not show up, but it is causing low testosterone. And it is one of the biggest reasons why men have low testosterone is because their thyroid is not functioning as well. And so we need to address this thyroid here by looking at the heavy metal toxicity level, by looking at the antibody levels, by looking at some of the nutrients like vitamin B6 and zinc and selenium and iodine, and make sure that men are getting enough of those nutrients that is so supportive for not only the thyroid, but testosterone production. And zinc, you mentioned in another talk how important zinc is in men. Would you like to comment on that, Doc?
Yeah, absolutely. So zinc and magnesium, both of them together, deficiencies in some research and some studies have actually showed a drop in testosterone levels. So we want to make a correction of these deficiencies if we can. There was one study that came out that showed after 4 weeks of supplementation with zinc and magnesium, correcting that deficiency, testosterone levels rose. Magnesium we can find in dark leafy greens, whole grains, just a few off the top of my head. And zinc found in dark leafy greens as well, flax seeds, pumpkin seeds. So when we start correcting these small little deficiencies like zinc and magnesium, we can start seeing total testosterone levels come back up.
Yeah, it's very, very exciting. And zinc is also very important for keeping that testosterone and estrogen balance in men, as well as it's vital in the detoxification system of heavy metals in our bodies. So zinc, magnesium, both of those are really important. Thank you, Doc, for that.
Absolutely.
So progesterone, one of the hormones that's often missed also is progesterone, and we think of that as a female hormone, but truly it is also a male hormone because it is the building block for sperm production and, again, testosterone. It's a very calming hormone. Oftentimes it's not checked on regular blood work for men, so it is something that we should be looking at for men, is their progesterone levels, their thyroid levels, their testosterone, their estrogen levels, their DHEA levels, as well as cortisol and SHBG, which you mentioned earlier, which is a sex hormone binding globulin. And when I see that elevated, usually the testosterone levels are low, but I also see it elevated in thyroid dysfunction, which again means that your testosterone levels are going to be suppressed because the estrogen is high. There is a question about, is there a test for the heavy metals in the body? There are several ways of testing for heavy metals. And one of the typical ones that has been used historically is a urine test, a urine challenge test, where we give intravenous DMPS or calcium EDTA, which is which are both what we call chelating agents. They bind heavy metals and they pull them out through the urine and some through the feces. And so you either do a urine test or a fecal test to measure the amount of heavy metals that are coming out after you have been given these chelating agents. However, these chelating agents can also be very strenuous on the kidneys. And it's something that I used to use frequently in the past, but now I've turned to a newer test out of Europe called Oligoscan, which is photos spectrometry. And that's really the gold standard for detection of metals and minerals in our tissues is photospectrometry. And so Oligoscan is a form of photospectrometry that basically uses light and the reflection, and absorption of light through the palm of our hands to detect all the different metals and minerals in our tissue level. And then we can intervene and see what would be best to help the body detoxify. And sometimes it is like giving the body magnesium or zinc, which are, by the way, the two most common deficiencies in our society because they are low in our soil. So, Doc, would you like to talk a little bit about the ways that we do increase testosterone?
Yeah, absolutely. One thing I do want to address is when you're talking about sex hormone binding globulin, there is an herbal supplement that I really like, but before you get on any kind of supplemental or vitamin regimen, please consult your doctor. But there's one called Long Jack, so also known as Tonkat Ali, has been used in traditional Southeast Asian medicine for centuries. It increases both free and total testosterone levels by decreasing sex hormone binding globulin. And then there's been quite a few studies on this herb showing that it increases sperm motility and concentration, can even produce free testosterone levels as well.
That's great. Maca is another one that we usually prescribe as well for both men and women, and depends on the strain of the maca, because certain variations of maca will increase the testosterone levels and decrease the estrogen in men. So it's another great plant to use for hormone balancing for men as well as women, depending on what may be going on. Any other suggestions for hormone balancing? Absolutely.
Vitamin D, another great supplement, actually acts as a steroid hormone in a sense by actually going into the nucleus of the cell. But there's a lot of research that's shown that correcting the deficiency in vitamin C or vitamin D contributes to increased total testosterone levels as well. And I try to encourage patients to get 15-30 minutes in the direct sunlight per day. Obviously, if you're at higher risk of skin cancer, we need to take some precautions around that. But living in the PNW, almost everybody up here has low vitamin D levels. It's kind of the thing we see. So definitely supplementing with vitamin D when that's necessary. Yeah, go ahead.
I just wanted to make a comment about the vitamin D, that it is often also overlooked, as you mentioned, for low testosterone is low vitamin D, and the vitamin D levels need to be checked as well. But, you know, in the Great Northwest, as you said, we're low in vitamin D, and sometimes oral vitamin D is not the way to go. I know a lot of people go out to the stores and pick up vitamin D, and I have an issue with that for a couple of reasons. I'm just talking about my issues, aren't I? Anyhow,
no, but I agree with you. I agree with you.
So the vitamin D that's usually oil-based can often be rancid. We don't know where it's been stored in the warehouses in the heat. It does usually come from fish, and it becomes rancid by the time you get it in your hands to take it. You're taking more of an oxidative kind of a pill that's causing more damage than you are an antioxidant, for instance. So vitamin D is very important to get in a powder-based capsule if you're going to take an oral. sometimes vitamin D can bind to the DNA of bad bacteria in our system. So if you do have a chronic infection going on and you're taking vitamin D orally, it can bind and activate the bacteria to grow when we don't want it to grow. So it is very, very important to have that evaluated by a physician as well, and not just take vitamin D. I prefer injected vitamin D, which is something that we do here at Holistique IV Lounge, is for people that come in, they typically come in to get their vitamin D shot, and we give them a very low dose once a month or a higher dose every 3 months to help build up that vitamin D without causing a problem with the bacteria in the gut or having any issues with the rancid version of the oils. Go ahead, Doc. You were going to say something else about one of the other nutrients.
Yeah, DHEA, you kind of briefly went over this, but it's a hormone that helps produce testosterone in the body. It's produced naturally by our adrenal glands, and it's converted in the body to testosterone and other types of sex hormones. There's a lot of studies that show that supplementation with DHEA can also improve testosterone levels as well. So,
yeah, definitely something that we need to evaluate, and it is one of those hormones that is evaluated on that Dutch test that gives us a better comprehension of what's going on. Now, one thing to also remember is that DHEA, it kind of is on a teeter-totter with cortisol. So as DHEA goes down because of stress, cortisol will go up, or vice versa. As cortisol goes up, DHEA is suppressed. And when we do supplement DHEA, it will bring down the cortisol. But if it brings it down too much, then we also need to keep that cortisol balanced, because that cortisol is a natural anti-inflammatory in our body. It keeps the allergies at bay, it keeps the inflammation and the pain at bay, and it's when it's too high that's the problem. And so that's one of the reasons we also do vitamin therapy intravenously here at Holistique, is because we want to make sure that we're giving the nutrients directly to these glands, like the adrenal glands, like the thyroid and the testes, through blood by giving the nutrients directly into the blood and having the blood carry it to these major glands in our body, and supplying those glands with the building blocks it needs to produce the hormones it needs to keep us in check.
absolutely. Just going into some of the things we should be, that also can affect testosterone levels, as well as we got to be mindful about our alcohol consumption. Alcohol damages the Leydig cells in the testes, which are the cells responsible for producing the testosterone. Another way that alcohol can lower your testosterone is a coenzyme called NAD+, is used for both alcohol metabolism as well as testosterone synthesis. And when alcohol is consumed, since it is a toxin to the body, our body wants to metabolize that and get rid of that out of the body as fast as possible. So we use the NAD stores, and it metabolizes alcohol rather than producing testosterone. Heavy alcohol consumption can also increase our cortisol, which has that catabolic effect, as we were talking about early on. Has the opposite effect of testosterone. It's going to break things down, and this is also going to decrease our testosterone synthesis. And there's been some studies out there that's showing that alcohol, especially hops, phytoestrogens and stuff like that, can actually increase the inversion of testosterone to estrogen in the body.
You know, I'm glad you mentioned that, because in the last month, as I've been doing more and more telehealth with patients, what I'm finding is that the number one issue that's coming up, both with men and women, is the increase in wine and alcohol consumption during this pandemic stay-home time, right? And more people are feeling anxious, more men are feeling more anxious, and they're feeling more stressed and more depressed. And it puts them on this vicious cycle of drinking more and more alcohol to help kind of run away from that. But it's actually promoting more of the depression and the anxiety, because it is reducing the testosterone levels in both men and women, and increasing the estrogen, which is so inflammatory and so disease-causing. So it is vital that we do keep a tab on the alcohol intake, especially right now, and monitor actually how much we're taking. And if you've been drinking every night, you may just not be able to tolerate even one drink anymore if you want to get back onto a better cycle. So please do consult one of your physicians, especially if you're interested in consulting one of the doctors here at Holistique. Please do so. We all are versed in addressing a lot of these lifestyle factors and helping with mood and hormone balancing. And it is very, very vital for our long-term health, but also for our immune health, right? Testosterone is very important for the immune system. And then the more we're drinking, the more we are causing toxicity, which weakens the immune system. And then we're more prone to catching some of the viruses and infections that are going around, especially right now, as everybody's on alert.
Yeah, absolutely. And I recently came across a study that said there might be about 1/3, just a little over 1/3 of men over the age of 45 actually have reduced testosterone levels. And it's kind of a factor of all these things we've been talking about over this interview or podcast, IG Live segment. So.
Yeah, we really have to change some things in this in our lifestyles here. So one other thing I wanted to talk about was peptides that we really haven't mentioned. And peptides are a really great way of increasing testosterone safely because peptides are chains of amino acids, and they're by prescription. And they're being more and more regulated. So we only have access to a few of these peptides, but they're basically involved in the signaling of various hormones. For instance, insulin is a peptide that signals the uptake of sugar into your cells. There's peptides that are involved for signaling testosterone production and reducing estrogen levels, and also balancing insulin levels, which is another one that we really haven't touched on yet. But insulin and your blood sugar regulation is of vital importance when it comes to balancing testosterone. If you don't address the insulin, you're not going to address the cortisol, and you're not going to address your thyroid, and then you're not going to address the testosterone. So that's the way I usually look at it, is fix the insulin and the blood sugar dysregulation, which is very frequently missed unless you do a challenge test via blood. So that's what we usually do. We challenge our patients with a high carb meal after they fasted, and then they go in and get their blood drawn for insulin and blood sugar. And we look to see what the insulin and the blood sugar are doing after that challenge. So we balance the insulin levels, then we balance the adrenal levels, which is your cortisol and your DHEA. Then we balance the thyroid, which is sitting up here and has this reciprocal kind of a relationship with the adrenals. And then finally, we look at testosterone, estrogen, and progesterone and all their metabolite. So it is a pretty complex system, and it's not so simple as just give our men testosterone, because that can get our men into trouble if we keep doing that. We really need to look at it as a whole picture. And I really thank you, Dr. Newell, for joining me today.
Absolutely.
And enlightening us.
Yeah, absolutely.
And I know we're out of time. Thank you, everybody, for joining us. It's been a pleasure. We'll do this again next week at noon on Thursday for both Facebook and Instagram Live. And we'll be focusing this time on women's health. And then on Wednesdays, we will be doing a Zoom presentation. If you're looking for the Zoom presentation, please watch for our email from Holistique E-News. Or if you're not signed up for the Holistique E-News, go to the holistiquehealth.com website and sign up. If you've missed some of this and you're really interested to hear more of what we just talked about, these lives are being saved, and so are the webinars, and they are either on my website, drdarvish.com, or they will appear on the YouTube, my YouTube website as well, Dr. Darvish. So please I look forward to seeing you, and please do make sure that you seek a provider to address your hormones properly and safely. Have a great, great weekend, and thank you again, Dr. Newell, and everyone. We'll see you next week.
Thank you everybody for your time, and Dr. Darvish, thank you for having me on.
Thank you. Bye-bye.
Bye.